Hello, Namaskar. I'm Gayatri Dipali Kulkarni. Today I'm making a podcast, or you can say an information. I'll be sharing information about what is yoga and medical yoga and what is the difference between them. Because I am being from a medical yoga as well as medical yoga practitioner and instructor. I have my own healthcare platform called Synergy Medical Yoga, and would like to also share what we do with Synergy Medical Yoga at the end of the or in between the information that I'll be sharing, especially talking about what is the difference between yoga and medical yoga. So let me begin with some misconceptions that people have about yoga and medical yoga. So yoga has different types, as some of you may know or may not know. Uh, Most of us, we are not aware of what is yoga and different types of yoga. So some people called it as Patanjali yoga, Iyengar yoga, or say Hatha yoga, simple yoga practice, power yoga, medical yoga. So these are the different terminologies which people have been using left and right without having a proper knowledge. No offense against it, but I think because of lack of knowledge that we have been talking about yoga as general, and yoga is for everyone, but it is not one size fit all, as all of you know, because everybody's body is different, everybody's thinking is different, everybody's stress level is different, our entire posture is different, the way we talk, the way we work, the way we bend, the way we kind of run, climb the stairs, or the way we sit like I'm sitting right now. It's totally different, and depending on your body structure, depending on your lifestyle, yoga has to be customized for everyone. If you are uh, don't have any conditions, and we'll talk about in brief when we cover that topic. It is good to do proactive or preventive yoga, which is generic yoga, where you can do some stretches, some strengthening exercises, and some twists, as you can say, or surya namaskar, which we call about, and of course pranayama also, which is a breathing technique, breathing methods are going to help you. But what is medical yoga? So medical yoga is anatomy, physiology, and medicine combined with yoga practices. So, people who have special conditions like, say, knee arthritis, or they have their gap in the knees have reduced, people who have sciatic pain, people who have herniated disc, or their spine or the vertebrae are not aligned one after the other, people who have neck pain, or they have stiffness in their neck, stiffness in, they have frozen shoulders, they have tennis elbow, or they have had an accident and they need rehabilitation, or someone had knee surgery for knee replacement and they need rehabilitation. It is different than physiotherapy. So we'll also talk about the difference between medical yoga and physiotherapy, which is mostly functional, and whereas medical yoga is holistic, which is treated specifically for the condition, but it also considers uh, uh, the entire body structure and how the alignment of it. So what is yoga? So we'll just talk about, I made some notes here so that it is easier for me to navigate and stay to the point that I would like to cover in this session. So generally, we know that people are saying, "Oh, I do yoga." Everybody's like, even when I completed my medical yoga course, my yoga instructor, even the basic yoga instructor course and the medical yoga course, everybody was saying that, "Oh, I do yoga. I do yoga." Yeah, it is okay. I'm nothing against doing yoga. It is good to balance your mind and your for in general well-being and preventive actions that you are taking by doing stretches and all. But do you know about your body structure? Do you know about where is your stiffness in your body, how your body structure is, what is your weight, how do you sit, what is inside your body, the different systems that we have, how they function, and basically different muscles and the bones and the joints and how they are joined together, how they interact with each other, and how the mobility happens, what is contraction, what is stretching, what happens when your muscles are contracted, what happens when your muscles are stretched. We are not aware of it. So I would highly recommend to have the basic understanding of your body, and we do offer a lot of courses at Synergy Medical Yoga where people can learn basics about anatomy and physiology, which is a very simple course, and you will have lifelong videos available so that you can refresh your learnings from time to time. And also some basic stretches are taught using different medical yoga tools. Suppose after a long ride or maybe a travel, sometimes your legs are paining, there is a joint pain happening, or your lumbar leg, which is your back, lower back is paining. So what you can do, especially when you have long travels or when you're going in the flight, what precautions you can take, or after the flight, before the flight, what stretches you can do with the help of props. So we'll talk about that as well. So when I see, generally yoga is nothing but a general practice, one size fit all kind of a I would say arrangement that is made. Most of the yoga instructors who take yoga classes, mass yoga classes, not personalized one on one, they have maybe say 10 people to 100 people. For example, Saurabh Botra, he's taking online yoga. So for him, he is not there with each and every person, right? So he's doing a generic yoga, which is good for well-being and your preventive maintenance and overall staying active. If you don't have any diseases or if you don't have any musculoskeletal issues, then in that case you can do it, but just also be mindful about your own body structure and don't bend suddenly. Consider your age also. So I would say that is yoga just for flexibility or stress reliefs? Not really, right? It can actually help heal diseases and make mechanical changes in our body. Because if you think that our bones and our muscles are nothing but mechanical structures in our body which holds our body erect or kind of help move us in different directions. So what I'm saying is that yoga is, yes, for general well-being, but medical yoga, again coming back to the same thing, helps us heal from different pain that we have in our body and also diseases, right? So I will give an example of, say, myself. I had a sciatic pain, say, in 2024 May. So after I had COVID, I don't know what happened, but I kind of started having pain in my right leg, right from my lower back on the right side all the way to my ankles, right? So it was protruding, it was going from now I can talk scientific language, which is L5S1, to all the way to my ankles, right? And it was my right leg used to feel hot from inside. I just someone is doing iron, ironing on my leg. It was having tingling sensation and numbness, and it was paining a lot in between. So then, since I was studying medical yoga at that time, fortunately, and my teacher from whom I learned is Nirama Yoga Chikitsa Kendra, so they also helped me understand what is sciatica and what is sciatic nerve. So based on the understanding and the learnings that I have had during my diploma course in medical yoga, I was able to treat myself with my on my own, as well as with my instructors and also therapist at that time, who helped me with a therapy of almost 6 to 7 months. My pain was reduced. Actually, I would say within 2 months I started feeling a difference, but the pain was still there. The numbness had gone has gone a little bit, but it was still there. It was not completely gone. But eventually, as I started consistently exercising particular medical yoga asanas with the help of tools, ropes, some of them I can name it as lumbar traction that I was doing, cervical, because entire spinal cord and the vertebrae are connected with each other. So after that, I would say around 7 to 8 months it took me. On a regular basis, I did medical yoga with props, and it helped me get relief from sciatic pain. And after a year, I would say it is completely gone. Why? Because I was doing mechanical changes. I was, when my L5S1 were fused, and then the nerve which was going from inside it, which was sciatic nerve, was getting pinched, and that's why I was getting this sensation and heat, hot feeling in my leg. So when we did the lumbar traction and a couple of other exercises of medical yoga with that, it increased the space between them. Also the nerve which goes from the vertebral points, which got the pinching was relieved. They had enough time, enough space to go, so that the pinching will stop. And of course, with particular mechanical change, and those are the mechanical changes which happened in my leg, and I completely am out of sciatic pain now. In between, when I'm traveling, I'm sitting for a long time, I do get pain in between, but then I know what to do because I have done it in the past. And I do Padangushtasana, I do Pavana Muktasana, these kind of things, and which help me kind of get over with the pain that I have. So this is how it is helping me stay healthy and take care of preventive as well as the reactive actions when I'm having issues. So general yoga, as we talked about, is good for holistic. It's called as holistic lifestyle system, right? It is useful to heal, and in terms of general preventive exercises, it helps in overall well-being, calmness, stability, and it is useful for prevention, as I said. Whereas medical yoga is the application of yoga. It is specifically considering into the anatomy and physiology and the medical and the yoga practices with the tools. Because when I was doing lumbar traction for sciatic pain, I cannot keep my legs all the way up without the support of any ropes, because it used to pain a lot. So I would just take it down for a minute if I didn't have the rope and belts which were tied to me and which helped me stretch my lumbar, putting my legs up, both my legs up. So I could stay in that position for 15-20 minutes. But imagine if you don't have any belts and ropes, and you're just asked to put your feet up without any support in a stretch manner, you will not be able to hold it for even more than a minute. So this is nothing but medical yoga is an application of yoga with specific tools, as I mentioned, such as rope, belts, bricks. Sometimes we use pillows, bolsters we used, which is very useful to address specific health conditions. So in my case, it was sciatic pain. We have a lot of patients coming to Synergy Medical Yoga, and our therapist, which go also at their home, patients' home, to help them get better and heal their pain, especially for the knee arthritis patients who are grade 1, grade 2, or grade 3. Medical yoga has certainly helped them avoid their knee surgeries, knee replacement surgeries. So in that case, what we do is we first look at the patient, how they are, what is their age. Most of our patients who have the knee issues, or I would say osteoarthritis of both knees or one knee, they are average 60 plus and above, and most of them primarily are ladies, because we know that women go through a lot of wear and tear during their life. They don't take care of themselves, and that's why we have a lot of lady patients who we are helping through Synergy Medical Yoga. Either they come to the centers that we have, or our therapist go to their house. So in that case, what they do is they have one-on-one attention. If you go to a center, there may not be one-on-one attention, but yes, one therapist can easily manage 3 to 4 patients if they are given different exercises. But at home, you get direct one-on-one attention, and the healing is faster, I would say. Yes, because you are given individual attention. The diet also is given to you. And then what happens is that with the knee separation, so as you see that your femur and the tibia are connected, and there is a patella in front. So if the distance between them is less, then with the knee separation it is increased a little bit, so that the friction which is happening with the cartilages and the bone is reduced. Of course, the filling of inside, which is the liquid fluid, it cannot be generated through medical yoga. So your eating has to be improved in such a way that the body itself is developing the fluid which is required between the bones of the knee, with the knee rotation. So if your knees are like bow knees like this, or if they are kind of knock knees, there is an opening. Knock knees have an opening inside your knee a lot. With the bow legs, there is a lot of opening outside. So it could be like, if it is knock knee, right, if it will be like this. If it is bow knee, it will be like this. From outside there will be a lot of opening. So what we do is, with the knee rotation, as I said, if it is like this, we rotate in such a way that slowly over the period, when you're doing it consistently, it start moving straight, so that your legs, instead of bow legs, starts coming. But if it is an extreme condition like a grade 4, as we talk about, then we highly recommend it to be knee replacement surgery to be done. And it will take a long time. So we do not promise any patients who have grade 4 level of knee issues, but we definitely can treat grade 1, 2, and 3. X-ray is highly recommended. So coming back to the same thing, so what medical yoga is basically, it is intervention, and it is not for prevention, right? If you already have some issues, then you should do medical yoga. But if you don't have any issues, you can definitely go for generic yoga. But make sure that you understand your body anatomy, physiology. And as I said, Synergy Medical Yoga do offer courses every month, and feel free to join them. I'll provide the link after my session, so that you can register, or you can call us and attend one of our sessions and one of our trainings, where you will get the basic awareness of your body, basic awareness of your musculoskeletal systems and other peripheral systems, which help support the body structure. So along with that medical yoga, you can continue taking your naturopathy or homeopathy, ayurveda or allopathy medicines. They don't interfere with medical yoga, so you can continue to take it, but eventually you will not need it. With the medical yoga, when the mechanical changes have happened, I don't think you will need it. So that's a good news, right? For sciatica, I never took any painkillers, because I was studying it, so I wanted to experiment on myself, and I bared the pain for few months, like 6 months, 7 months, but it started reducing, so I could bear it easily. So it helps. So that's what I'm trying to say. So as we know that medical yoga is more therapeutic, and it is application of yoga. It is intervention medicine, interventional practice, and tailored to specific conditions. Like I mentioned some of them already while giving examples, is osteoarthritis of the knees, then the back pain, neck pain, vertebral alignment, tennis elbow, frozen shoulder, herniated disc, sciatica. There are many that you can talk about, and then they will help you make those changes in your body, mechanical changes, with the help of medical yoga tools. So medical yoga, as I said, is more personalized. You cannot do it in the groups like we do the yoga classes, which can be done right from 10 people to thousands of people together. That's not how medical yoga works, because it is as an prescription based. For a specific condition, it is prescribed. And I will talk about when someone, how to choose whether I should do yoga or whether I should do medical yoga. So it is very important. The first thing that we have seen with a lot of people is that, oh yeah, okay, you have this pain, okay, you come and I will take care of it. But make sure that when you are working with any yoga therapist, that they have disclosed their certificate in their class, or if they are taking online, that you have the right to ask for the certificate. And if they are practicing medical yoga, again, you are authorized, and it is legally required for the instructor to disclose the certificate that they have received, that they have completed the medical yoga training, and it is still valid, and they have refreshed it. If it is like 10 years ago done, make sure they have refreshed it if they haven't practiced. So make sure that you are verifying it. The therapists which work with us, the centers that are connected with us, all of them have trained medical yoga professionals, teachers we call them, or the instructors, therapists, and they have the valid license, and they have the valid certificate, I would say, for practicing medical yoga for preventive health, I would say, method, and the prescribed medical yoga exercises for them. So in the real life, I would say, again, if you do not have any serious health conditions, but if you just want a general well-being and stretches and strengthening exercises, then do generic yoga, which can be your studio yoga, or you are joining a class of say 10 to 150 online classes. You can do it, not an issue. But make sure that you have a mirror in front of you, if possible. Look at your posture, check your age, check if there is, do blood test, preferably on a regular basis, and see if there are any issues in your blood test. If there are, then do not go after generic yoga, but check first if medical yoga can help you more. Try that for say, do medical yoga for say a month or two, and when those conditions are stabilized, you can always go back to do generic yoga, and you don't have to continue doing medical yoga, which is a prescription based yoga. So medical yoga helps with enhancing the healing, again, as I said. And just make a note of it that it's not a replacement for doctor. So if you have arthritis of your knees and they are in the x-ray, it shows that there is no gap, so do not consider medical yoga will heal it 100%, because it has gone to such a condition that it will not help you take care of it. So make sure that you it's not a replacement for doctor. Okay. And yes, at our healthcare platform, which is Synergy Medical Yoga, we do have doctors associated with us who are orthopedic, homeopathic, allopathic, as well as Ayurvedic doctors, who do review from time to time when we are giving therapy to our patients who are seeking medical yoga therapies for the special conditions for healing. So yoga is generic, as I said, it's one size fits all. Actually, it is not, but yes, an instructor is doing one asana and everybody pretty much follows that, right? Surya Namaskar also, it's not for everyone if there is a condition that you have. So first fix that condition with medical yoga, and then you can go after generic yoga, provided that all your X-rays and all your tests are coming normal. Then you can continue doing your regular yoga, but definitely go for medical yoga to heal first and take care of your musculoskeletal issues or your diseases that we have. So one thing that we have observed is there are a lot of patients that come to us that they have been doing general yoga for years and years, and now their stiffness still has increased. Their neck is kind of cracking all the time. That means there is less lubrication in your vertebral neck vertebral from cervical vertebrae, I would say. And they have also vertigo is a common problem that we are seeing these days, again, which is a pinching of nerve, which goes to supplies to your brain and which goes to from your brain to your body and vice versa, right? So make sure that you do general yoga only when you're fit, right? Only when you don't have any issues. And if you have kind of herniated disc or osteoarthritis when you're bending, if you're not bending properly, right? Because most of us bend from our back, we don't bend from our lower back, which is our gluteal muscles. So I know this is very technological term, but that is always off. So if you have a hump when you're bending, it's the wrong bending, right? So these are the things we definitely teach in our introductory medical yoga class. So I would highly recommend you to attend that. Okay. So for medical yoga, it's a prescription based yoga, and the teacher in medical yoga or the instructors are called yoga therapist. And in general yoga, which is done by most of the people, they are yoga instructors, right? They are not therapists, because they are not treating any particular condition of a patient, right? They are giving general fitness stretches and strengthening exercises using yoga. So medical yoga, what do we do in medical yoga when the patient and the person comes to us? So it is first the assessment is done. So we take medical history of the patient, if they have had any accidents, any seizures, or any falls that they had. How do we look at their posture, how they are standing? Are they sitting like this, or are they sitting like that? Are their legs straight, or are they, when they are standing, are their feet like this, or they are toes in and heels out? How they are standing? Are they standing with their tummy coming out, or are they standing straight? So these are very assessment level observations, that tests that we do, physical also. And we also ask them to provide their daily routine on what they are doing, what type of work they are doing. So it's all like how the doctor takes the medical history. Similarly, we take the medical history. If there are any x-rays done, if there are any blood tests done, then we definitely take into consideration that we also have doctors with us who will review what the medical condition of that person is, and based on that we provide a plan for the patient on what exercises using medical yoga tools and techniques can be given to the patient, so that they can start seeing the difference and see the healing process and how they are getting healing. So again, as I said, it's assessment based. It is prescription, which is nothing but we also give them the diet, if there is any diet that they should follow. We also give them, if they need to do any x-rays or any special tests to make sure that they see the difference on what their x-ray was, and maybe in 3 months 4 months from doing exercises, what their x-rays have the condition gotten better. So for we get a lot of patients, especially for, I would say, sciatic pain and for osteoarthritis of knees, right? So in that case, typical exercises, you can search them online, you will have it available. But of course, there are certain techniques needed to kind of perform those therapies on the patient. So don't try it on your own. I would not recommend trying it on, but definitely get a training on that, and then with help of therapist or with help of the centers that you'll be associated with, you can try them. So knee separation is a common one that we gave, knee rotation for osteoarthritis patients. For, I would say, calf stretch also is one of them that we give them. Then we also give them foot stretch, which is also very important for the knee pain. If you have, say, lumbar issues like back pain, lower back pain issues, sciatic pain, then lumbar traction is like definitely helping, because I have done lumbar traction. It's my favorite because it really helps me feel relaxed, and all my back muscles, lower back muscles, and the lower back vertebrae are stretched, which is very good, and it gives enough space for the nerves to flow through and carry the messages, right, and not get pinched. And it is a wonderful exercise. If you have shoulder pain, then what we do is we recommend highly to have the um, arm stretches if you have frozen shoulders. But don't, just because some people cannot even lift their arm till here, right, they can only lift. So do the hand movements first, little bit, that also we will teach you. Then eventually you can do the stretches, back and forth movement of your shoulder. Then once you are comfortable, there is a movement in your shoulders, then you can do rope jacket, which is like by attaching ropes here and to the hook, you kind of lean forward or move forward a little bit, and so that your hands are stretched at the back. So these are and the movements of the hands, you can do. So these are some of the exercises that we, depending on your condition. So medical yoga is nothing but medicine and anatomy, physiology, and yoga tools combined together to help heal a particular musculoskeletal issue or a disease that a person has. And it is assessment based, it is prescription based, a history is taken, there are records kept, and the person has been educated on what they should do at home to avoid increasing the pain. Instead of that, how they can reduce their pain by doing some exercises at home. And we also ensure that we have, from time to time, we are having a session with our yoga therapist, who will do the refresher of the medical yoga course that they have done. They'll discuss the patient's case with the doctor. So there's a team of doctors, dietitians. So all of them come together and give personalized training and personalized therapy to the patients. So let us compare. I have made few points about what is the difference between general yoga and medical yoga. So what is the goal? So the goal of general yoga is general fitness and kind of well-being, right? But what is the goal of medical yoga? So it is symptom management. So if you have pain in your shoulders or in your neck, you cannot just simply move your neck, because some people are even stuck, they cannot even move their neck. So we do cervical traction, then we do little neck movements little bit, and it is guided and it is practiced with the therapist monitoring it. So it is a rehab, right? Symptom management, specialized medical yoga centers are there, clinics are there, and it's a private practice. It is personalized training. You don't have, like, say, one yoga instructor talking to, telling, doing the same yoga for thousands of people, right? It is specific prescribed yoga. Here you can have one-on-one sessions, or maximum one instructor maybe treating 3 to 4 patients at a time. So what is the setting, right? What is the setting of general yoga versus medical yoga? So in general yoga, as we see these days, there are centers available where there is a group yoga, right? Everybody's coming together and they're doing same exercise, like Surya Namaskar, Bhujangasan, Padangushtasan, or they are doing Pavanamuktasan, or they are doing say dog pose that everybody loves. Everybody talks about Adho Mukha Svanasana, all that's a Padmasana, but not everybody can do Padmasana, right? Their conditions are different. So then any yoga that can be done online, without any instructions, or in a studio with say 50, 30, 100, 10 people. Then it's in the gym. Then gym there are classes, they are all general yoga, they are not medical yoga. So medical yoga, as I said, there are specialized centers which are run by the yoga therapists. They are called yoga therapists because they are trained in medical yoga. There are also private classes where private, I would say, one-on-one sessions given, uh, and the teachers are very trained. They are called yoga therapists. And there are yoga clinics, they are called as clinics, they are not centers, or they are not like say yoga instructions given by one person. So they are one-on-one. So assessment, if you assessment, specialized treatment is given. So who will do the general yoga versus who will do the medical yoga? So general yoga certified teacher by Ayush Mantralaya of India, or even worldwide, right? There are a lot of yoga I would say institutes which teach and give certificate. So they do not teach in detail about the anatomy physiology like they do for medical yoga. So the basic course that I would recommend everyone to do is the yoga course first, if possible, which is generic yoga, and then you can go for specialized, which is medical yoga, as I said, right? So this is what generally we highly recommend. So yoga teacher who will learn the medical yoga diploma, or they'll do a degree in it, can practice medical yoga. So what is the class size? Again, I talked about it is a large size. When we are talking about generic yoga, it is a large size, right? There is from 10 people to thousands of people. Like for example, Saurabh Bothra is teaching online. Maybe there are 1,000 people or 10,000 people doing it at a time. But that is a generic yoga, and it is good for general fitness and preventive well-being. And then whereas the class size for medical yoga is one-on-one, you can have one therapist versus one patient, or you can have maximum one therapist with three, because they have to use the tools by tying the rope and belt. So it takes time for the therapist to work with the patient, and you have to hold that one position in the stretch manner, or in the strengthening manner, for at least 10 to 15 minutes depending on your condition, right? So these are the differences basically I would like to say between the medical yoga and the yoga is. So let's look at some of the uh, when do you choose yoga? I'm kind of repeating this topic before we end the session, is that how do I know that I need yoga or medical yoga, right? Because generally people are saying, oh, I do yoga at home. So what do you do? I do Surya Namaskar. Okay, that's fine. But if you have sciatic pain, right? If you have lower back pain, or if you have neck pain, or if you have frozen shoulder, or if you have tennis elbow, which is it's flexible, it doesn't have any strengthening in it. So you cannot just say do regular yoga, because it will worsen the pain that you have. It will not help you heal. So in that case, do not choose generic yoga. First, as I said, take care of your condition. Make sure that that condition is completely taken care, it is healed, and you are feeling better. You are well now, right? You are fit person, right? In that case, then go for generic yoga, which is for your general maintenance, prevention, and for your well-being. But if you are fit, you don't have any issue, you just kind of haven't been exercising, then you can try the general yoga first with the class, maybe say of 10 people, 5 people, whichever is in your area, or you can do online. But do an assessment first of your body, right? And we can provide that as well, right? We can provide the assessment of your body, then you can do say medical yoga with us for say 10 sessions, 5 sessions, which is like a week or 10 days maybe. And then you can practice generic yoga on your own, or you can looking at online classes, and you can do. So in summary, what I want to do is, you don't have to choose one, you can do combination of both, as I said. So if you are not aware, if you're the first timer doing yoga, then you can always come to us at Synergy Medical Yoga. We can do your assessment, and we have told many customers, many patient of ours, that hey, you don't need yoga, medical yoga, you can go for general yoga because you don't have any conditions which need treatment. So there are people who have come to us. We have told them that this pain is not very severe pain. With these one or two, few exercises, you will be better. And then we have recommended to do general yoga with the connections that we have in the yoga community. But people who have had neck pain, knee pain, or certain pain in their bone, muscles and all, or stiffness is there, their body posture is not correct, they are in a lot of stress and anxiety, depression, then for them we have recommended medical yoga. And then once they have felt the difference, and they have healed, or they are in the path of healing themselves, and they see the difference in their body, in their diet, in their sleep patterns, then once they have healed completely, maybe from say even 1 week to say 6 months, depending on their condition, then they have gotten back to regular yoga. So I would highly recommend that you don't get fixed upon, say, hey, what do I choose? Do I choose Iyengar yoga, Hatha yoga, general yoga, power yoga, or medical yoga? All of them are types of yoga. It's just that yoga is generally not one size fit all, right? Depending on your condition, depending on your body, you should choose the yoga asanas that you should be doing on a regular basis, and with the help from an instructor. Because while you're bending, while you're stretching, while you're twisting, if you don't know about your body, about your muscles and bones, you're definitely over the period, may not be immediately, but if you keep on doing it, you may have issues with your muscles and with your bones and the way you're turning. And we get a lot of patients who have been doing yoga on their own, and they have kind of twisted something very badly and all that, and then they come to us. I'm nothing against them. Yes, people do have a tendency of doing things on their own, and we have helped them heal. Some of them have healed as early as even in 5 days, right? Some of them have taken say 1 or 2 3 months to heal, because they badly kind of twisted, and it has kind of broken sometimes and all, because over the period, through the gravity and degeneration, our bones have become weak, our joints have become weak, we don't know how they are connected. When we are moving, when we are sitting, bending, it kind of uh, does wear and tear in our body. The kind of food we are eating also matters, right? The thought process that we have. So this is how I'm saying that yoga and medical yoga, or all types of yoga, can be performed by anyone, provided you have done your assessment correctly, then you have been prescribed which yoga you should do. Because Iyengar yoga also has different types of practices. They also have general yoga, which can be performed by everyone. They also have specialized yoga, which is again a medical yoga type, where they treat diseases and different musculoskeletal issues. So another thing is very important: when you are doing yoga with an instructor, check for their credentials. What is their certificate that they have? Is it authorized certificate? How long they have been practicing? Do they have any people that have given reviews about them? Have they benefited from it? Same for medical yoga, same for hatha yoga, all other yoga types that you should talk about. So basically, at the end, I would like to say that yoga is like a toolbox. General yoga is like a toolbox, and using the right tool at the right time is very important for you. So don't it's not a generic one. So make sure that yoga has lot of benefits, lot of tools and techniques which can help individual uh, have preventive well-being practices, as well as specialized assessment based, prescription based yoga therapies which will help their particular condition. And yoga is very powerful. I have had experience of doing yoga since my school days, where I was participating into competition. Now I'm against it totally, because yoga is not for competition. It is for your own well-being and not to show off to everyone. But of course, that time I wasn't aware of it. But it's been, like, I would say 40 years I have been practicing yoga. um, in between, for say 15 years, I did not practice it, and then I saw the issues that I have had experienced, because I was not practicing it on a regular basis with proper guidance. But then since last many years, I would say 10 plus, I have been practicing it with a proper therapist, which has helped me get better and achieve my goals on a daily basis. So yoga is very powerful. So thus I'm saying that yoga is very powerful, but when applied with medical wisdom, it becomes transformative, and that has helped me. I have transformed myself, and I have overcome my digestive issues, my sciatic pain, my mental stress, my anxiety, and my overall well-being. I'm able to achieve. I am at my ideal weight right now, and I know how to maintain my weight with the yoga asanas that I'm doing, with the diet, which is the holistic planning that my therapist and my doctor has given me. So I hope this session has helped everyone understand the difference between different types of yoga, especially the general yoga, that group sessions that we talk about, online sessions that they do we talk about take, versus the medical yoga. If you have any questions about medical yoga and the trainings that I mentioned about medical yoga, if you're interested to attend them, they are online, but the practicals are in person. The theory is taken online and the practicals are in person. We also have monthly in person on site trainings at different locations in Maharashtra and across India. We are also conducting them in USA soon, with the practicals taken in person. The theory can be taught online. So feel free to contact us at www.synergymedicalyoga.com, and we will be happy to help you and guide you on how you can heal yourself with medical yoga, and then how you can continue practicing generic yoga for your overall well being after you have healed completely. Thank you so much. Namaskar.